Yes, it is Health Diary. My name is Gladys Gashanja and we're coming to you from the Eastland Hotel here in Nairobi. Now, since the COVID-19 epidemic became a reality, a lot of you have written to us to break down what exactly are coronaviruses and how you and your loved ones can protect yourselves from the same. And that's why today we shall have a specialist helping us break down this conversation, and we shall start off with the fact of the matter. Coronaviruses are a family of viruses that cause a range of illness in humans, including common colds and more severe forms like severe acute respiratory syndrome (SARS-CoV) and Middle East respiratory syndrome (MERS-CoV), which are life-threatening. The name coronavirus comes from the Latin word corona, meaning crown or halo, and under an electronic microscope, the image of the virus resembles the solar corona. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. The World Health Organization was alerted in December of 2019 to several cases of pneumonia in Wuhan City, Hubei Province, China, the origin of the new coronavirus strain. The new strain was named SARS-CoV-2, or commonly known as COVID-19, in reference to the year it broke out. COVID-19 has since rapidly spread, infecting thousands and claiming many lives in China and beyond. Currently, there is no specific antiviral treatment for COVID-19. Therefore, treatment is supportive, which means giving fluids, medicine to reduce fever, and in severe cases, supplemental oxygen. With timely treatment, those with mild cases of the virus have totally recovered without special treatment. Those who contract COVID-19 are advised to work with public health authorities to determine when they are no longer contagious. So the new strain of coronavirus, now known as COVID-19, has dominated our headlines, and many have asked what exactly this is and how come it seems to be claiming so many lives. So today, let's take time to talk about coronaviruses, because apparently this one is just one of the many coronaviruses out there. And to help us with this conversation, we have Dr. Isaac Ngere, who is a researcher with Washington State University. Thank you so much for your time. Now, Dr. as you heard me say, COVID-19 is actually part of a family of viruses. So let's start with, what are coronaviruses?
It's a large family of viruses. They've been with us for a long time, from the 60s. We've known about 4 of them that have been causing mild respiratory illness. They cause coughs. They cause sore throat in people who are affected. And these have not been a big problem all the way until the year 2002, when we got the first big outbreak of a coronavirus, and that was the outbreak of SARS, which started in Asia, and then that spread to other countries in the world, killing about 800 people. So that's when people started paying attention to coronaviruses. In the year 2012, we had another outbreak of the Middle East respiratory syndrome coronavirus, which also currently it has affected over 2,500 people, and it has killed about 800 of those. Then late last year, moving into this year, I think on 31st of December, we had now the big one that everyone is talking about currently, called SARS-CoV-2. That is, it's SARS coronavirus 2. Because it also causes severe acute respiratory syndrome. But it causes a condition or a disease called COVID, coronavirus infected disease.
Okay, so what makes these viruses similar?
They all cause respiratory illness in varying degrees. So out of all the 7 coronaviruses that we know that affect humans, we have those that cause mild respiratory disease, and then we have also the 3 that cause severe respiratory illnesses.
Now, you mentioned about the SARS and you mentioned about the MERS, the one for the Middle East. What made these so severe back then?
They were affecting older people. They were affecting people who have underlying diseases. So people who have heart disease, for example, there are people who could be having diabetes, for example, people who have prior history of surgery. So in some essence, they were affecting people whose immune system was a bit compromised. And within that category of individuals, they were causing severe disease. The scientific community actually took note of that, and that's the reason why people are worried about coronaviruses. In the case of COVID-19, the mortality rate is quite low. With time, the case fatality might settle lower than 2%, but then still people are worried about it because different from the other two, COVID-19 spreads really fast.
COVID-19 that we're dealing with now and the SARS-CoV back in 2002 all seem to originate from the Asian region. But we had the MERS-CoV that came from Saudi Arabia. Why all the way in the Middle East?
It was for a very simple reason. MERS-CoV is transmitted to humans mostly when they come into close contact with camels. So what happened is that in the Middle East, people tend to associate with their camels differently from the way people associate with them in Kenya. In Kenya, we have these free-range nomadic pastoralists who keep large herds of camels, and they allow them to graze out in the open field. If you go to the Middle East, people do zero grazing with camels. They have thousands and thousands of camels in intensive farming areas where they keep them and they milk them. So the interaction is a bit more close. And then again, also the MERS-CoV that has been found in the Middle East is different. If you look at it from the virology point of view, it's different from the one which we have in the African camels. And we think that those two reasons could be explaining why we found it in the Middle East and maybe not in African countries, despite us having camels in the two places.
Why animals? What is the connection?
These viruses don't cause disease in these animals. And when they cross over from these animals to humans, they cause disease. And that's what happened in the case of MERS-CoV. In 2012, what we think happened is this organism must have acquired some property which enabled it to cross over from one species of animals to the other. And that is when now they cause outbreaks. Even in the 2002 SARS-CoV outbreak, we had the civet cats. There are cats which are out there in the wild, but at that time there was a very booming trade of those cats. And it's thought that it could have come from a bat to the cat, and then maybe through their interaction, close interaction with humans, we got the disease jumping from the cat to humans, causing the initial cases in an outbreak. But then after that, now we have human-to-human spread, which now leads to the massive outbreaks that we see.
And when you talk about transference, are we talking about ingestion, or is it bites from these actual animals? How does it transfer?
Nobody really knows exactly how it happens. What we have are theories which have been fronted based on how we expect this disease could have left the animal host. Now, for the case of camels, it's just close contact with the camel. You know, when they cough, they sneeze. I'm told people kiss camels, people hug camels. So during that close interaction, you will come into contact with respiratory droplets from the camel, and you're likely to get infected. The people who eat some of these animals, of course, they are not cooked well. If you handle it, it's not cooked well. We think that's one of the mechanisms in which you can get infected. Again, also, there are some of the waste products from these animals, the urine, the feces. Through some of those mechanisms, we expect that people can get infected. So when you come in contact with these animals, and close contact, even if you live together with them in a house, then that can predispose you to getting the infection.
Okay, now we've been told about the new strain, which is COVID-19, to have pneumonia-like virus or symptoms, and also it mimics the symptoms of a flu. What exactly are these that would actually differentiate it from a normal flu?
Actually, it's difficult to differentiate coronavirus infection from normal flu because it presents like flu, especially in the early stages. So this is usually also a common pathway of pneumonia, which can be pneumonia due to viruses. Pneumonia can be due to bacteria. So it becomes really difficult to differentiate the two. What I would like to say, and what we encourage people to do, is that if you have any symptoms of flu, then that needs to be checked by a doctor. So you need to visit your doctor so that that is checked. If you have symptoms of flu, that is fever, you have cough, you have sore throat, you have sneezing, you have headache, you have muscle aches, you need to get checked up by a doctor, and if there's any close contact with you between you and someone who has recently traveled from those areas where we are seeing the outbreak, then that needs to be notified to the ministry. So that's the only way we do our surveillance. We look for these symptoms, and then we try and associate you with that traveler, or if you yourself you had traveled from the Middle East, then you become a suspect case.
The conversation today, COVID-19, the new strain of coronaviruses that has been headlining in the recent past. To help us talk about this, Dr. Isaac Ngere, who is a researcher with the Washington State University. Now, before we went to break, you said it causes pneumonia. Yeah, and it has said it can lead to pneumonia in severe cases, severe acute respiratory syndrome, which is SARS, and kidney failure, rather, and even death. What causes such extremities? How does it get you to that point?
In very simple terms, this virus binds to some receptors or areas in the body which can actually receive the virus. A lot of those receptors are located in your respiratory tract, in the lungs, lower down in the lungs. We have a lot of those receptors also in the kidneys. So the interesting part is that once the virus is there, it causes a very intense inflammation, which is sort of like the way the body reacts to an infection. That kind of reaction leads to a lot of swelling, edema, it leads to damage of cells, and that damage will most likely occur in areas where we have those receptors. And that's why during an infection, you get a lot of pathology or a lot of disease occurs in the lungs. And then when it progresses, it can also lead to kidney failure, because kidneys also have those receptors which can bind the virus.
Okay, now I know there isn't enough known about the epidemiology of this virus, but from your experience, what informs the severity of a case? Is it dependent on your immunity, your age, and especially for COVID-19?
People get infected across all ages. Now, in terms of disease severity, if we look at a majority of people who have been affected, those who have had severe disease, we see the age is actually advanced, and a lot of them also have underlying conditions, mostly either lung condition or a heart condition, which is being treated.
Now, they have said COVID-19, it takes 2 to 14 days to actually exhibit symptoms. Is this something that is common also with the other coronaviruses?
The incubation period, or the period between infection until you show symptoms, is more or less uniform. It's 2 to 14 days. There are people who can show symptoms as early as within a day or two. That is a minority of people, but majority of people, we wait for until 14 days before we declare them disease-free. And that is also the basis of how we do our surveillance. That's why when we do quarantine or with a strict movement, we usually do 14 days count from the day where we suspect there was contact. So once we keep you for 14 days, if you don't show symptoms and your tests are negative, we are almost certain that you don't have the disease.
Now, half the world is walking around wearing masks and others are wearing gloves. Can we clarify on how coronaviruses are actually transmitted?
Coronaviruses get transmitted through respiratory droplets. What that means is that when you cough, when you sneeze, or when you don't practice appropriate hygiene around coughing or sneezing or cleaning your nose, you're likely to deposit droplets containing the virus either on parts of your body or even on inanimate objects. And that's the reason why around the world people try to protect their breathing system using the masks. Or in other areas also you can see people try to do things like cleaning of hands, cleaning of surfaces much more frequently, because the virus can only be found on surfaces which have been contaminated.
Okay, and there are other quarters that say if you have somebody who has the virus or has symptoms like, you shouldn't even use the same bathroom with them.
The general rule is that when someone is suspected to have coronavirus, especially during quarantine, what we encourage them to do is to really restrict their movement, to try and restrict their contact with other people. And the way you do that is to avoid using a lot of shared amenities.
There is word that it could also be passed on through fecal matter and also mother-to-child transmission.
We still really don't have clear evidence to say that the virus can be transmitted from the mother to the baby through placenta. So what we know is that around birth, there's a lot of contact, and if hygiene is not practiced well, it's possible that the virus could be transmitted from the mother to the baby, or even from a person who is around the area where the child is born to the baby, or even among the first people who come into contact with the baby. That has to do with hygiene. So what we know is that a lot of these viruses, because of the severity of the illness, if a mother got infected, they really need to be treated early, and they need to be looked at very carefully, because they can lose the baby or we can lose the mother.
How about the fecal?
Fecal transmission is possible because when someone is infected, they shed the virus through various means. You shed the virus through body secretions, including saliva, including just respiratory droplets when you cough, mucus, and that can also come out through feces.
And now that we're talking about prevention, we know it exists and it's here with us. How do I protect myself from contracting this condition?
What we try to encourage people to do is to practice hygiene around coughing, sneezing, and especially when you are, coming into contact with other people in the public space. For those who have cough or symptoms of cough or sneezing, they need to practice appropriate hygiene practices. You should cough into maybe tissue, or if you don't have, you can cough into into your elbow, and just make sure that you don't come into contact with other people. So in terms of personal protection, the most powerful tool that we encourage people to do is just personal hygiene, hand washing, and cough etiquette.
Okay, now there was caution that we avoid public places. Now, in the cases of churches, malls, schools, all these are characteristic of crowds. How do you contain it with those factors in mind?
Controlling outbreaks which affect masses like SARS-CoV-2 or COVID-19 is really difficult. Now, for the case of Kenya, we still don't have any case confirmed in this country. We just urge people that even if you go for these public gatherings or public functions, what you need to do is to practice personal hygiene. So in places where there's already an outbreak, an outspread outbreak, we actually encourage people to just keep away from public.
Now, adults can comprehend the fact that you're saying hand washing, coughing etiquette. Kids, with their free spirits, how do we contain this? How do we protect them?
Generally, most infectious diseases, you can control them by practicing basic hygiene, and hand washing is on top of that list. It's a practice which we can start cultivating early. We teach them hand washing. They don't have to be perfect in it, but then as they grow into the practice, so it becomes part of them.
WHO is encouraging all countries to enhance their surveillance. The question here is, it takes 2 to 14 days to show symptoms of any coronavirus. With that in mind, how then do we prevent and control such on a national scale?
If we get the first case of coronavirus in Kenya, and even in any other country apart from China, it's going to be associated with air travel, or maybe travel by sea, as we've seen with the cruise ships around the world. So if we do a good surveillance around those areas, then we are protecting the masses. Now, for those people whom we suspect they could have come into contact or could have originated from the hotspot, and by hotspot I mean in the specific province in China where the outbreak is ongoing, we recommend that we quarantine them. And I think currently Kenya is one of the countries that has capacity to test cases, and therefore if there is a case which came through any of the ports of entry, we are able to identify it, and then we are able to institute necessary measures. But a lot of this is just preparedness.
Now, you talk about the country having the capacity to test. Do we have the capacity to treat?
We have capacity building, which the ministry has been doing with the partners. We've been having health workers being trained in priority facilities like Kenyatta. We've even had training for staff at JKIA so that they're able to know how to do screening and even how to respond when there's a suspected case. We've also done some of those trainings in Nakuru and Mombasa. And I think this one the ministry is doing together with the partners, and it's an ongoing activity. If we get cases, treatment is again a little bit tricky because we still don't have any drug which is effective or has been proven to be effective against coronaviruses. We are still having trials And that's why most countries, they really want to prepare so that they don't reach that level of treatment, because it's resource draining. Patients can get respiratory failure, which means these people will need to be admitted in a high dependence unit or an ICU. And how many spaces for ICUs can even a country have? It's not unlimited. And therefore, countries try to prevent these cases, because if we get overwhelmed, then it becomes really difficult.
And now that we're talking about preventative medicine, is there a chance that we can have a vaccine for coronaviruses so that we mitigate the effects of the same?
Despite having SARS-CoV in 2002 and MERS-CoV in 2012, even up to now, we still don't have vaccines against those two. We still have drugs which are being trialed. So we are still a distance from that, but the global community has resources, and I know they are working towards trying to get a vaccine for coronaviruses.
Okay, so Daktari, before I let you go, do we have hope in surviving a coronavirus in Kenya?
We have hope because we first of all know that if the first case is going to come, then it's going to be an imported case. And that's really valuable information, because now we know where to look for it. And that means our efforts are going to be focused around preventing that first case from coming into the country. Now, on a different note, what we've seen in the rest of the world, even in China, which is a world superpower, everybody is struggling. With coronavirus, everybody is going to be struggling. There's a lot of conversation currently on universal health coverage. What I don't know is whether that conversation includes research into emerging diseases. Because the next threat, someone said, is not what we know. We've done so well with malaria, we've done so well with HIV, we've done so well with TB, we've done so well with diarrhea. But are we prepared for the next outbreak? Because that next outbreak, no one really knows about it. No one knew about this COVID-19. And with the systems that we've developed over time, since we had the SARS-CoV outbreak, we had the MERS-CoV outbreak, we even had the Ebola in West Africa, and now the Ebola in DRC. The world has really ramped up its preparation for the next outbreak.
Okay, Dr. Isaac Ngere, researcher with Washington State University. Thank you for your invaluable information, and definitely it has been said over and over again, hygiene, hygiene, hygiene. Coronaviruses are here with us, and you can only protect yourself if you practice personal hygiene. Time now for a health tip.
Health tip brought to you by Good Life Pharmacy.
We have vitamin C, which comes in different formulations. We also have chewable tablets for vitamin C. Those ones you basically just chew once in a day. And we also have capsules, which are you swallow. For the kids, we have the option of drops. You can give that to your child on a daily basis to make sure that the child does not get the flu. We have the day and night tablets for the cold. It allows you to go on your daily routine without causing you any drowsiness. This one's cause you drowsiness, so you will be able to sleep throughout the night well. For the kids, we have the option of the liquids. So we have the liquids for the kids and the tablets or capsules for the adults. You get all this from any Good Life outlet. We are all about you.
Health tip brought to you by Good Life Pharmacy.
If there is a show that epitomizes prevention is better than cure, it has to be this one on COVID-19, one of the coronaviruses that has really hit the headlines. Remember, as Daktari said, prevention is better than cure, and the best way to do so is to actually observe your hygiene to the T. My name is Gladys Gashanja, and we've been coming to you from the Eastland Hotel here in Nairobi. Until next time, see you